歡迎大家嚟到今日嘅
Welcome to the press briefing. On stage, we have Dr. Zhang Chukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager, Quality and Standards from Hospital Authority. Dr. Zhang will give us an update of the situation. Last night, we had 39 new confirmed cases, a case number from 10284 to 10322. One is an imported case from South Korea, case number 10315. After our rapid test, done by our public laboratory, the strain was found to be M501Y, variant from the UK or South Africa. The variant virus from the UK and South Africa contains this gene, and further investigation is needed. We've got 38 local cases, among which 20 are of unknown sources, and the remaining 18 are linked cases with current cases. Today we have new buildings subject to mandatory testing. Is Tower 7 of Laguna City. 2 units are infected with 1 case respectively each. They are more than 10 stories apart but of the same orientation. Regarding Tongfat Building, Block C, 60 residents were evacuated last night, and there are a few units yet to be followed up on to confirm whether they are occupied or not. Block 5 of Laguna City, we obtained 25 samples previously, and they were all tested negative. Yesterday, a reporter asked about container number 9 of Kwaichong and whether there were workers confirmed. I didn't have information with me yesterday, and there were 3 preliminary positive cases, and usually we would ask a site to suspend works for 14 days pending thorough cleansing. And upon further checking information with us, there was some mistake. There was no case tested positive among the 3, because usually a few samples are pulled together, and then there was a very very weak negative positive case, and the contractor tested further, and 2 were hospitalized for further testing, and so far no case has been tested positive. Regarding the variant of the virus, we have found 1 more case similar to the variant virus found in the UK, and it's 9913, case number 9913, returning from Doha, from Switzerland through Doha, and she was on QR 818. And the case was identified or detected when in Hong Kong. The case from South Korea, well, apart from that, we have number 9946 arriving on the 21st of January. The case number 9948, and also case number 10315 have both got the gene M501Y. We've yet to classify whether it is the variant found in the UK or in South Africa or elsewhere. That's all from me today. Thank you. Dr. Lau, please. Thank you. As at 9 a.m. today, at the past 24 hours, the HA system has reported 71 reportable cases, and today 2 more confirmed patients have passed away. A 47-year-old man with underlying disease, number 8452. On the 23rd of December, he sought help at A&E Department of Cornwall Hospital on the 23rd of December, and he was sent to an isolation ward for treatment, and then he was confirmed afterwards. And he was tested positive. However, his condition continued to deteriorate, and then he passed away at 8:32 this morning. And then there was another male patient aged 66 in United Christian Hospital, case number 7259. He passed away today as well. He has a chronic disease, and then on the 10th of December, he was transferred from quarantine center to UCH for treatment. His condition continued to deteriorate, and then he passed away at 12:16 a.m. today. Including the patient who passed away at Cornwall Hospital yesterday, the case number was 10291. A total of 172 confirmed patients have passed away in our public hospitals. As at 9 a.m. today, in the past 24 hours, another 72 confirmed patients were discharged. So far, 9,239 patients have been discharged. As at 9 a.m. today, 836 patients are being treated in 24 public hospitals and AWE community treatment facility. 32 are in critical condition, 37 in serious condition, and the remaining 771 patients are in stable condition. The number of negative pressure beds activated is 1,220, occupancy rate 69%, and we've got 672 negative pressure beds with the occupancy rate at 76%. May I supplement regarding the 2 units in Laguna City? Well, in 1 unit, there are actually 2 confirmed cases. One was sent to hospital from a quarantine center. And Q&A. Please identify the organization you represent before you ask questions. The reporter in green. Good afternoon. I've got 3 questions. Your organization, please. I'm from cable TV. I've got 3 questions. The first is, now for a Tong Fat building and the congee shop in Hong Kong, now there are clusters there. And then I'd like to know whether there is a new cluster associated with the container terminal. And the second question is, now should there be a surprise restricted area? Then what will be the arrangements for the Hong Kong funeral service providers? And if an area to be restricted in a surprise move, how will you deal with people who have to go off work or to be away for meals? Will there be gray areas? And can you tell us the orientation of the infected units in Tower 7 of Laguna City and the number of people yet to be tested in Tower 5 of Laguna City? Well, there were 5 preliminary positive cases in Tong Fat building. They are now all confirmed. In total, there are 13 cases. And the same as what was reported yesterday. From the congee shop, there is a new case, a worker. He was confirmed in a quarantine center, including family members. There are 7 workers plus a family member of a worker linked. So when there are over 10 confirmed cases, they will be uploaded to the internet. Regarding a sudden sealing off an area, I have no information to disclose now. And for Tower 7 of Laguna City, the units are of the same orientation. From Now TV, for Tower 7 of Laguna City, the flats are of the same orientation. Can you tell us the flat number? And I'd like to know whether the design of Tower 7 and 5 is the same. Now, although they are not of the same block can it be possible that there is already vertical transmission? And what is the expert's view? Should evacuation be done, or are you going to wait for more cases to emerge?
Usually, there have been cases from many buildings previously, and many of these cases came from units with the same orientation. Whether there is indeed vertical transmission in this particular case, we don't know yet, but we are going to put them under mandatory testing if indeed the number of units that has been carrying positive cases has exceeded a certain number. Of course, we shouldn't wait till there is confirmed vertical transmission before we pay any attention to environmental hygiene and cleanliness. I think everybody should keep the U-trap filled with water. I don't know exactly how the ventilator works, but I think the bottom line is that we should keep the environment as hygienic as possible. Next question, please. The one in the back from RTHK. Yesterday, at the Hong Ham congee shop, a cluster has occurred. I'd like to know whether there are any new cases that are linked to the congee shop cluster. If so, would you require customers of a congee shop to undergo mandatory testing? And also for the specified areas, I'd like to know whether there have been any new cases coming out of those. And also, what about the preliminary positive cases? It seems that the overall number is coming down. Is it that it is flattening out, or is it that this is only temporary? Now, for the congee shop, only one worker has been tested positive at the quarantine center. And so altogether, 7 workers are in the group. And also there are other close contacts. But we have not detected that any customers have been tested positive. But we are going to keep a close watch over this. As for today's positive cases, how many of them came out of specified areas? For Jordan, there is 1 case. For Yamate and Mongkok, 3 cases. Sham Shui Po, specified area, 2 cases came out of that. And for Hong Ham, specified area, no cases came out of that one. For preliminary cases, 40-odd preliminary cases. Next question, please. The lady there. Where are you from? I'd like to ask about HA. Now, for Kwong Wah Hospital, the contractor, China Construction, said that 2 workers have been tested positive. Actually, they were positive last week, and today works have been suspended for 14 days. We'd like to know whether you have received the information last week. Why is it that the Prevention Center as well as HA have not released such an information? Are you trying to cover up? We also like to know who are these workers, what are they working on, or what kind of work procedures are they working on? And also we'd like to ask about Dr. Zhang. 7 cases actually have become symptomatic starting from the middle of the month. We'd like to know why is it that it was so late before they were being confirmed, and were there any high-risk factors? And also, concerning the Yamate area, the experts already learned that many of those cases actually have to do with the mid-Kowloon construction site cases. And so is it that the Prevention Center actually has not done a sufficiently good job with regard to tracing, even with the advent of the Kai Tak Center? Is it that you are still understaffed, even with the Kai Tak Center, so that the pandemic is still spreading? Let me talk about the Kwong Wah case. My information shows that 5 workers are in that Kwong Wah cluster. Now, usually, even if there is only 1 case coming out of a construction site or coming out of a construction office, we would require the office or the site to suspend works for 14 days. Of course, that is only a recommendation. And then we will send the close contacts to quarantine center. And then we'll keep a close watch as to whether further cases occurred. And then we'll see whether those cases are linked. And then we will check whether there is any places where the workers would congregate, such as changing rooms or canteens and so on and so forth. Now, if in the event where all of a sudden there is a large number of cases occurring, such as 7 to 8, then I would mention it at daily press briefings, such as the congee shop. But for certain clusters with only 4 to 5 cases, then I would not mention them. But if the number of cases exceeds 10, then we would upload the locations, because it would be regarded as some sort of an outbreak, and so that is really our standard. I'm sorry, the speaker is speaking off mic. For Kwong Wah Hospital, they learned, or we learned the information or the news from the construction contractor for redevelopment project. And all along, we have been in communication with the contractor. And after we've learned of the situation there, and we are given to understand that they have been doing cleansing and also sanitizing work. And we understand that they have also been following up on this with CHB as to how to keep the workers hygienic and to keep the environment hygienic. The construction site is totally under the charge of the contractor. Of course, if there is any problem, they should inform us. And we noticed that it would not involve any patients or any medical staff and would not impact on our service. And that's why we did not make a particular mention of it. But of course, if we are aware that the public actually is aware of this, or actually is concerned about this, then of course we will rethink our procedures and criteria and see whether that should also be divulged in future. Now, as for tracing of the Mid-Kowloon route construction site cases, all of the relevant family members and also close contacts would be subject to tracing and would be sent to quarantine center if necessary. But for individual cases, if the person, either because they failed to inform us or either they've forgotten what kind of environment they've been in or what kind of contacts they've made with other people, or whether they have been going to very crowded places, or because of certain environmental factors such as very close spaces or ventilation of air or the lack of it and so on and so forth, then for these cases it would not be possible for us to use tracing in order to cut off the transmission link. So concerning tracing, that is not involving close contacts, such tracing would be largely ineffective. Now, if someone is living in a partitioned flat, and once we discovered the case or discovered the problem, then we would immediately send people who are sharing the overall unit or apartment with this particular person to quarantine center. Now, for the Kwong Wah site, actually not only Kwong Wah site but all sites, once we have learned that there have been cases, then we would recommend that they should suspend works for 14 days and all of the workers should be tested, and then there should be thorough cleansing and so on and so forth. Now, this is our standard. But yesterday I heard that for the Kwong Wah construction site, it seems that the contractor has not decided to suspend works for a full 14 days. And so we have asked our colleagues to remind the construction contractor that they should be aware of this requirement and recommendation.
Speaker was off mic. Well, I have not gone into the details, but some of them have got some rather unmarked symptoms. For instance, loss of appetite starting from the 11th of January. So these are the symptoms reported to us. So they only told us so after they were sent to quarantine centers with confirmed cases in the family. Many of them reported loss of appetite and a mild headache, so on and so forth. So given that we have a pandemic here, it's not like when we didn't have the coronavirus or COVID-19 pandemic. So if you have a dry throat or mild sore throat or mild coughs, many may feel that it's because of the weather. Well, even if you don't want to seek medical help, you should at least get a sample bottle.
Questions from RCHK English News. First, currently with more tests being done, but we are kind of seeing fewer cases. Is that a good sign? And with only 2 weeks left for the Chinese New Year, are authorities confident that the outbreak can kind of be brought under control before then? Second question regarding Laguna City, Block 7. Is the design kind of similar to that of Block 5? And is it possible that there will be another situation, another case of vertical transmission going on there? Third question regarding the Konghua Hospital construction site. And as you kind of mentioned a little bit about earlier, and according to different reports, the contractor kind of only stopped work from today, or they didn't completely stop work for 14 days, the complete 14 days period. Is that a satisfactory situation? Can the CHP only make suggestion and do nothing else in regards to that? And like, would that kind of allow the virus to spread among workers who might, well, for somehow still be working despite of orders from CHP? Thank you.
We still cannot comment on the trend, whether it's actually decreasing trend. I looked through the cases, unlinked cases, confirmed today, and looked at their addresses and so on. I found that the cases are spread throughout the territory. They live in 樂富, 大角咀, 牛頭角, 元朗, 大埔, North District, 太古城, Central District, 羅便臣道啦嚇，東發大廈, 深水埗, 嘉湖山莊. So I think the cases quite widespread in the community, although there are sporadic cases here and there. And so if any of them, they come into a situation where there may be super spreading events that may cause another major outbreaks in the community and further upsurge in the cases. So we have to be more careful and vigilant in our personal hygiene and environmental hygiene. And I understand not only Laguna City, many buildings in Hong Kong, they have various designs, construction sites designs that may, I'm not sure, may facilitate, not facilitate, may contribute to the spread of the infection through the environment. So what we can do, that we have to observe all these buildings and the spread, and whether there's any vertical or horizontal spreads. And actually in a few buildings we did find some horizontal spread, in the neighbors, ABC, something like that. And we have in fact removed some of the residents nearby, consider them as close contact to the quarantine camp. But for the vertical spread transmission, the cause seems to be quite a few. Depends on the ventilation and all the drain, and also the different spatial the spatial design of the buildings, which I'm not very familiar. So we will add on the cases. So when we observe any abnormal distribution, we'll try to invite experts to come and see. But for the general public, I think we have to be aware because we are all living in high-rise buildings, and all these designs may occur in our own buildings. So we have to try all means to try to prevent the spread in the buildings. So far, I think all these contractors have been quite compliant. What I received the news is information is that they only want to stop, suspend for 2 or 3 days. So they had stopped the construction site, but they did not intend to stop for the 14 days, probably because of some communication problem between us and them. That's why we asked our staff to contact them again to reinforce that you have to stop 14 days in order to stop the spread in the site.
Is it satisfactory that not the whole 14 days they're just going to stop?
I think they did not resume the work. They just plan to stop. According to what I heard, that's why we try to ask them to reinforce our message. Yeah.
問多條英文問題，前邊呢位。
Hi, Dr. Chung. You said that it's too early to say whether or not there is a general decline in the overall trend, overall cases in Hong Kong. But what is your assessment in the overall trend of cases found in the 4 designated testing centers, testing zones? Because as you said today, there were only 1 to 3 cases found each in each of these areas. Do you think that the epidemic there or the spread there is coming to an end? And as you said, the unlinked cases, you've looked at them and they are spread right across the city in many parts of Hong Kong. Do you think therefore there's a need to expand those designated testing areas to cover more districts in Hong Kong, not just the current 4? Secondly, there are more cases containing the variants of the from first found in the UK and South Africa. Can you tell us how many variants, how many of these cases are there in total from both Britain and South Africa? And finally, can I get your thoughts on a research just announced by the University of Hong Kong this morning about vaccine confidence, because it showed that more than half of residents do not intend to take COVID-19 vaccines. As the Department of Health is responsible for rolling out part of the vaccine program, do you think that it is a cause for concern, and what do you plan to do to increase people's confidence? Thank you.
Actually, we are for all these buildings over the territory, if they have 2 cases, 2 units affected, we'll put them under the compulsory testing notice. So this try to cover all the other buildings in the territory. Of course, we can't because if there's only 1 case in any building and there's no spread, maybe at the present moment we will do 2 cases, 2 units at the present moment and observe. And also the number of cases in the designated area seem to a bit lower than the previous few days, but of course there may be fluctuations, so we still have to observe. And there are a total number of 16 variants similar to the UK strain and 2 similar to the South African strain. And also we have 2 unclassified at the moment because our laboratory did a quick test and found that they are of 501 and 501Y. They have to do whole genome sequencing to determine the exact strain. And I do not have any comments on vaccine, etc. I'll leave it to my colleagues.
下一條呢位。
Next question, please. Good afternoon. I'm from Ming Pao. Just now, Dr. Cheung mentioned N501Y variant case 9943. Because earlier on we saw that the case number showed that it was a local case. But actually the number is 9943, said Dr. Zhang. Now my question is that 6 cases have come out of the airport. 9935, 9928, and 10250, and so on and so forth. I'd like to know whether they are staff of the airports and what kind of line of work are they working on, and are they interlinked, and whether there are any transmission links. Have they been in contact with any visitors arriving in Hong Kong, and whether they are carrying any mutant variant genes of the virus. And then for the Kwong Wah hospital construction site, 5 workers have been tested positive. I'd like to know what are their case numbers and what kind of work procedures were they working on, and have they been using the lounge room or the restrooms, and how many workers are there in the construction site, and how many of them have been tested, and how many of them have been quarantined. Now, another question for HA. It's a case 10118. This patient has passed away. We'd like to know when did he or she died, and whether he was suffering from any chronic illness. Now, for 10118, let me answer that question. This patient was a confirmed case. He was at around 9,000 odd in sequence number. We understand that this patient had got a family member that had passed away, and he or she was chronically ill, and the death occurred at home. Now, because time was pressing, and that's why we asked forensic colleagues to help us to get a sample to see whether it was a positive case, and indeed the sample showed that it was a positive case. Because this person himself was already ill, and so when he passed away, it was not at first thought that he died from COVID-19, but because he was epidemiologically linked, that's why we asked the epidemiologist to try to get samples and try to test for whether he or she was carrying COVID-19 virus. Now, as for the Kwong Wah hospital workers, indeed, the positive cases had come together for meals, but not all of them knew each other. And the total number of workers were 300 to 400. And some of them have been sent to quarantine center indeed, but I do not have the number. Because the number is not especially high, and so I have not mentioned the case numbers. It has come to our attention that at the airport, indeed, staff from different locations have been tested positive, but so far we have not detected any link among them. And some of them were working at the canteens, and some of them were luggage handling personnel, and others were from construction sites. We are still keeping a very close watch over this, and indeed we have stepped up testing. And there is always the possibility that these people contracted the virus from their own communities and neighborhoods. But of course, we will keep a very close watch over their close contacts and whether there is any need to expand testing to a larger scale. The person in green clothing. I've got 2 questions. The first question has to do with Laguna City. For Tower 7 and Tower 5, I'd like to know whether they are environmentally linked, and also whether the positive cases are linked to each other, whether there is any possibility that there is environmental contamination. Now, you have not yet confirmed whether there is vertical transmission, but the 2 towers actually share the same design in piping. And so we'll consider getting experts down there to have a look to see under what conditions should there be a major evacuation. Now, today, it seems that there is a marked drop in a number of cases. Now, is it because of the ambush lockdowns? Now, is there any ground for you to relax the restrictions in the run-up to Lunar New Year? For Laguna City, Tower 7 and Tower 5, I reckon that they should share the same design, but not all units have been affected. And actually many buildings in Hong Kong share similar design, and many of them actually have already produced cases. And so we have to watch whether there is indeed any possibility for vertical transmission. If for a particular building, and if there are 2 units facing the same direction have produced positive cases, actually such buildings are very, very common. And there have already been a lot of such buildings. And so we have to see whether there is any vertical transmission. We cannot rule out vertical transmission for these 2 towers. And that's why we have subject the 2 towers to mandatory testing. And if the number of cases becomes larger, then of course we have to see whether it should be, or the 2 towers should be subject to mandatory testing as the other tower at Laguna City. Now, indeed, today's number of cases has shown a market drop, but still we have over 40 preliminary cases, and so we cannot say for sure that the trend is now going downward for total number of cases. We still have to be careful. I've got 3 questions. First question, I'd like to ask about the congee shop in Hong Kong, because yesterday we went there to have a look, and also we have asked the residents living nearby, and they have indicated to us that that was actually a very crowded space. We'd like to know whether CHP has gone down there to survey the environment and also to see whether the workers working there have wear face masks, and also have you assess what kind of environmental risk there is. And so, under what circumstances would you require the customers that have patronized the congee shop to undergo mandatory testing? And as for the Kwong Wah hospital site, we'd like to know whether the workers that have been tested positive there also work at other construction sites. And for hospital authority, on what day did the contractor inform you that there have been positive cases coming out of construction site, whether they have delay notifying you? So do you have any guidelines for prevention of the spread of COVID-19 in terms of requiring the contractors to manage the distribution of work in a certain manner? Now, it seems that there is certain delay in testing the sewage samples. We'd like to know what kind of procedures the health department have in analyzing the sewage samples. Would you link that to analyzing the symptoms of the cases and also environmental risk factors? Now, for the congee shop, actually, its condition is shared by many other eateries in Hong Kong. But of course, there is now a cluster developing there, which means that there is an outbreak there. And so, of course, we have to keep a close watch as to whether any customers have contracted the virus. Now, if the spread is only among workers, but not covering customers, then of course it is less worrying. But if we have received news that customers of a certain number actually has contracted the virus, and very possibly from that location, then probably we would have to subject all customers that have patronized the shop within a certain period of time to undergo mandatory testing, as we have done with some other restaurants. As for sewage sample testing, Environmental Protection Department and Hong Kong U and other government departments are in charge of analyzing the sewage samples, and so they are the professionals in doing the analysis. As for the Kwong Wah Hospital construction site, now let's deal with this from 2 angles. First, China Construction, the contractor, is working on that construction site. Of course, all of their work procedures and whatever happens on the site should be notified to us. And starting from the 24th, an apprentice who worked at the construction site had been tested positive, and that was being put to us in the process of notification. And of course, the contractor already knew that it had the responsibility of cleansing the site, and CHP, of course, was also alerted to send people down there to do testing. All along, we are in very close contact with the contractor, and this contact will remain. And we will continue to be in very close touch with the contractor, and so that we can have a full idea as to what's going on at the site, including whether there have been any cases and how the site is being managed environmentally and hygienic. And of course, we have communicated to the contractor that if then anything happens, then they should inform us as soon as possible.
Good afternoon. I'm from HKET. With regard to patients with the variant of the virus, what are their conditions now? What are the symptoms? And can you clarify what is the latest number with regard to deaths? In public hospitals, 172 patients have passed away. Some did not pass away in public hospitals. I've not heard of, most or all cases involving the variant of the virus, they were all imported cases, and they are younger in age, and I've not heard of any deterioration in the conditions. Last two questions. I'm from Commercial Radio. I have a question in relation to Tung Fat Building. I'd like to know whether new cases from blocks A and B, and we're told that a few units from Block C would have to be followed up on. Are they subdivided units? In Quarry Bay, it appears that the number of cases is rising with older buildings involved. Will you consider making the area a specified area? And for a variant of the virus, have you checked local cases? How can you assess whether we have local cases with variants of the virus? For some units in Tung Fat Building, when our colleagues went to evacuate residents, some of the units were not answered, and then we will have to contact relevant persons to see whether those units are really not occupied, and we'll try to see how we can locate the residents for them to be sent to a quarantine center. According to information I have now, we do not see any confirmed cases from other blocks. It might be the case that the reports have not yet arrived because some testing was done last night. Now, our public laboratories, as far as I know, are doing that for all positive cases. Another rapid test will be done to see whether the M501Y gene can be found. If so, we'll be informed first, and then a more comprehensive genetic analysis will be done. So we've covered local cases as well. Last question. Specified areas, that is a question for the administration. I'm from AM 730. A few days ago, some older buildings have their sewage samples tested in Toka 1. Are there any new cases? And we're told that a doctor from Department of Health became confirmed after seeing a Chinese medicine practitioner. However, the onset of the disease of the latter only took place after five days after the consultation. Can you tell us the duties of the doctor concerned? Had there been any contact with patients? And we're told that case number 10118 was only tested positive after the case passed away at home. How come testing was done 1 week after the case passed away, and what was the viral load? Was it high or low? And is there any close contact? Was the case sent to the morgue, or when was the sample taken from the deceased? the doctor of Department of Health is responsible for advice for traveling. So he works in a clinic, and any close contact will be sent to a quarantine center. I don't have information on the number of close contacts he has. As for the person he has contacted, we found it strange as well, because the onset date was 23rd for both. But we've got linked cases with the Chinese medicine practitioners on the 19th and the 21st respectively, and they are both close contacts. One accompanied another person to consult the CMP, another one was a patient. So it was possible that that was already during the infectious period. As we all know, the onset date of COVID-19 sometimes cannot be confirmed because the symptoms may be very mild, involving a slight headache, and then the person may not be aware of it. So we've already traced all patients who consulted the CMP after the 18th. They all have to be quarantined, but the number is not high. To Kwa Wan, so far, a Manu building in Manyun Street. Now there are 2 units with 4 confirmed cases. So Manu house is a sewage sample case in Jordan. And then Yu Chao Street, I don't know whether I mentioned this. No, this is not the one. Not related to sewage sample. We don't have any so far. 10118 case number. The case passed away at home, and then a few days afterwards, a family member fell sick and was confirmed, and then we found out that a family member had passed away a few days before, and it was not suspected to be a case. So we asked that a sample be taken from the dead body at Fushan Mall. Close contact. It was already identified because they are in the same family, and then the case has also got underlying disease. I don't have information on the viral load. All right, one more supplementary question. The reporter on the left. I'm from Cable. I have a supplementary question to ask. Regarding the Kwangwa Hospital construction site, what was the date of infection, and where do these 5 cases live? Do they live in the specified area? And I'd like to know the number of residents in Laguna City that have yet to be tested, and how will the administration follow up? And then, hang on. And then, in the last 2 exercises involving restricting an area, there were cases found not to have complied with compulsory testing. I'd like to know whether the government has followed up, and will they be prosecuted. For the cases of the Kwangwa construction site, they do not live in specified areas. The number of residents that have been subject to mandatory testing, I don't have the figures with me. And if a person has violated the law on compulsory testing, I know that colleagues concerned have followed up. Should there be sufficient evidence, they will be charged.
That would depend on the law. Of course, the law might say that the person has already contravened the law and should be subject to prosecution, or whether he or she should only be subject to mandatory testing?